Vision by Design Optometry, and we just want to spend a little bit of time educating patients about what sort of services we provide to the community and what sort of things we do for our patients. So with me here today is Jenny. Thanks for coming in again today, Jenny. And we'll give you a little bit more information about what you can expect when you come into Vision by Design.
Okay, what are some of the things you do at Vision by Design, Sarah?
We do, the typical routine eye exam. So this is what people typically expect when they go into an optometry clinic. So we test for your glasses prescription and make sure everybody's seeing clearly. And we also check the health of the back of the eyes. So we look for conditions like glaucoma and macular degeneration and things like retinal detachments, and check patients who have diabetes and stuff like that. We also provide emergency eye care, so if anyone has anything from an infection to if they got a piece of metal in their eye, or if they're having symptoms like flashes or floaters, we do see patients the same day for stuff like that. We also provide glasses for patients, so we focus more on doing more customized products. So we ensure that our patients, get a really good education on what sort of lens designs will work best for what they actually use their eyes for. And we have a lot of fun with certain frame designers and stuff like that are really kind of funky and look really great on different face shapes. And then we also provide vision therapy in Edmonton as well. So vision therapy involves doing activities to train your visual system how to work more efficiently. And we also do this for post-concussion patients or anyone who suffered a traumatic brain injury.
Nice. And why is there a need for Vision by Design to do those kind of services?
I think everybody needs really good eye care. So we use our visual system for so much. 80% of the information we gather from the world is actually visual information. So it's something that we're using on a day-to-day basis, no matter what we're doing, especially nowadays when there's so much emphasis on computer use and digital devices. I think it's more important now than ever to ensure that you have really optimum eye care so that you can comfortably use your eyes throughout the day.
Is there a specific niche that you choose to serve at Vision by Design?
Yes and no. So for our routine eye exams, we see absolutely everybody you could imagine. So we see infants as young as 6 months of age, all the way up to seniors well into their 90s. So we are able to provide services for absolutely everybody for routine care. We do provide more specialized care for patients, as I mentioned, who have visual inefficiencies. So this often involves children with learning disabilities, people who have had traumatic brain injuries such as concussions, or people who just have developmental visual issues as well. So we have a little bit of a specialty niche, but we also provide care for absolutely anybody who would require it.
Yeah. And how often do your patients seek out your services?
It depends on what services. So typically for routine eye exams, we do recommend annual exams. I do like to do an annual exam just because we do spend a lot of time focusing on ocular health. So we always like to really get a good look of the back of the eyes and make sure that there's no issues with diseases or anything like that. Other services, such as emergency services, sometimes patients need them. They need them when the emergencies arise. We'll have other patients where they're coming in for things like dry eye evaluations, where you're seeing them more frequently. Vision therapy patients we actually will see on a weekly basis. And we have some patients who are always coming in for glasses because we're getting lots of new stuff all the time. So they come in multiple times a year to kind of check out what's new. So it depends on what we're offering, but we tend to see our patients fairly regularly.
And what is the biggest problem you solve for your patients?
Just to provide comfortable vision. So I think the most important thing patients are wanting to have solved when they come into their office is to be able to use their eyes in a way that's efficient and comfortable. So in this day and age, there's so many concerns with discomfort from digital devices when you're on the computer, to dryness living in a dry climate, to having blurry vision and stuff like that, or eye strain after spending a long day at work. So I think the biggest thing we solve for patients is to ensure that they can actually use their eyes comfortably and efficiently throughout the day, so that they can do all of the activities that they really love to do or have to do throughout the day without having constant visual symptoms.
How efficient are you at communicating treatment options to your patients?
That's something that's really important to us at Vision by Design. So we always make sure that we spend adequate time with the patients, reviewing their test results. We have a lot of really neat diagnostic equipment where it takes images of the back of the eyes, so we can take photos of the retina and scans of the deeper layers of tissue. These are great tools for communicating with patients because you can actually show images of what you're seeing in the back of the eyes. I always love to spend a little bit of time chatting with patients about what they use their eyes for specifically. This has allowed us to come up with really, great kind of creative ways, to prescribe specific lens designs or, specific needs for contact lenses, for instance, to ensure that they're getting adequate comfort. And this is really helpful to reduce symptoms such as eye strain or headaches or fatigue that patients experience at the end of the day. So overall, it just leads to better results when we spend a little bit of extra time communicating with the patients and kind of seeking out what exactly their needs are.
And how do you currently find your patients?
I would say most of what how we typically will acquire a new patient right now is definitely word of mouth from existing patients. So we're really fortunate that our patients are quite happy with the services we provide. So they're always sending in friends and family to come and see us. So that's definitely our biggest source of referrals. We also work with a number of professionals in the city who will send us patients who are having issues with their visual systems, whether it was from a concussion or teachers from schools, for instance, if they are noticing children are having difficulties as well.
Okay.
Yeah.
And how competitive is your industry?
I think optometry can be collaborative, depending on what sort of services and stuff that you provide. I mean, I think there's a really fantastic network of doctors in Edmonton, and everybody is, looking out for the best interest of the patient. So we've had a great opportunity working with other doctors who will actually refer back and forth for our services. So, there's competition in the sense that there's lots of options for optometry in Edmonton, but I think we're really fortunate as a community to have a really professional, collaborative group of optometrists that are really out to serve the community.
And why are you motivated to be the best in your industry?
Really, the motivation comes down to being able to provide the best for my patients. So, it's less of a desire to be the best optometrist and more of a desire to make sure that I'm always providing the best quality of care. Because of this, I always seek to, learn more and educate myself and, be able to provide more advanced care. And we're always bringing in additional treatment options and, diagnostic scans and stuff like that. Just to be able to make that patient experience better and more efficient. So the strive to continually improve is motivated by just wanting to give my patients the best possible care that we can possibly give them.
And what are you doing to reach your goal?
So as I mentioned, one of the big things that I really like is technology in the office. So whenever there's new equipment that comes out, technology is really amazing in the eye care field nowadays because we can take images where we can see things that just wasn't possible to see previously. So this allows us to diagnose things like glaucoma, at much earlier stages, which makes treatment much more effective. So technology is something that I really enjoy in the office, and I'm always motivated to bring in, the latest and the greatest that there is to offer. Other things that we like to do are, expand our services. So, when I see patients and I feel that there's continued issues that are arising between a number of patients that, we're not able to solve those problems, I always try to seek out different solutions, which kind of led me to, providing vision therapy. So we're seeing patients where they come in and they just have these visual concerns that don't really seem to be met by just doing a routine eye exam on them. And, I was always amazed that, when you start digging a little deeper, you do find visual inefficiencies in, the ability to focus or, track an object, for instance, and that's actually the root cause of a lot of their symptoms. So, I do find that being able to provide specialty services such as vision therapy has really elevated how I'm able to provide really great quality care for my patients, even my primary care patients.
Nice. Well, thank you for answering some of my questions.
Yeah, you're welcome. I hope that gives everybody a little bit more information about what we do at Vision by Design Optometry. We have really been enjoying providing comprehensive eye care for patients in the Edmonton community, as well as vision therapy in Edmonton. And if you would like to check us out, feel free to head over to our website at www.visionbydesignoptometry.com or give us a call at 780-444-6407. We look forward to meeting you.